Hey, and welcome back to Know Your Infections. Today we'll be tackling a big question that affects millions of people worldwide, and that is, when do you actually need an antibiotic? Spoiler alert, a lot of infections do not require an antibiotic, but when they do, they are lifesavers. Let's dive right in. What are antibiotics really? One may be willing to know. Antibiotics are medicines used in the treatment of bacteria. They work by either killing the bacteria or by stopping them from multiplying. Antibiotics do not work on viruses and fungi. Think of an antibiotic as a sniper for bacteria, not a bomb, boom, for all microbes. The following are infections that do not require an antibiotic: common cold, flu, gastroenteritis, also known as stomach flu, and most sore throats, except the ones caused by streptococcus. All you need for these infections are fluid, rest, and targets to the symptoms you're experiencing. You do not require an antibiotic. The following are infections that you may need an antibiotic: urinary tract infection, strep throat, that is the one caused by bacteria streptococcus, bacterial pneumonia, skin infections and wound infections, cellulitis, tuberculosis, and typhoid. It's important that you confirm with your med lab scientist if you require an antibiotic and the choice of antibiotics to go for. What are the dangers of antibiotics overuse? The primary danger is what we know as antibiotics resistance. When antibiotics becomes resistant to an infection, then the antibiotics would not work for such infection. And when this happens, there will be more hospital stay, more costs, and even more deaths. World Health Organization lists antimicrobial resistance as one of the global leading health threats. Here are 5 warning signs that you may need an antibiotic. However, it's important to double check in the laboratory. The first is high fever that wouldn't go down, most likely greater than 38.5 degrees Celsius. When the symptoms you're experiencing lasts more than 10 days, is more likely infected by bacteria. Next is when there is the presence of pus in a wound. Next is pain when urinating, accompanied by fever. And of course, when the lab test confirms the presence of bacterial infection. It's important that when you're experiencing any sign as this, you put a call across to your doctor. Do not self-medicate. Here are 4 patient tips to ask your doctor in your next visit. The first is, do these ailments require an antibiotic? Next is there a test to confirm if I am having a bacterial infection or not? The third is, what are the side effects that I should expect while on these medications? Finally, the next thing you should ask your healthcare practitioner is if it's necessary that you finish the entire dose. Asking these questions makes you more aware of your medications. It makes you a smarter and safer patient. Antibiotics can be miracle drugs, but only when used correctly. Let's protect our health and the function of these antibiotics by knowing when to say yes or when to say no to antibiotics. Like, share, and subscribe to spread this awareness of antibiotics. Keep your family antibiotic smart. Next episode, we'll be talking about what is antibiotic resistance and is it something to be worried about. Until then,